Hey guys, and welcome back to the show. I am your host, Megan Hardy, and I am the founder of Fitness Uncharted. And today I am joined and welcoming back a special guest, Dr. Callie Womble. She actually joined us on episode 62, where we talked about posture and prenatal care. And if you are a soon to be mom, a current mom, a postpartum mom, any of those things, an aspiring mom, you probably want to go back and give that episode a listen because that was fantastic. And today she is back to talk with us about another topic that a lot of people struggle with, and that is headaches, migraines, and vertigo. So we're going to talk about common causes and treatments that can help you guys. So, hi, Dr. Callie. Welcome back to the show.
Hey Megan, thanks for having me back. I'm excited to be here again.
Yes, so excited to have you. You gave us just a wealth of information and knowledge on episode 62. And I think a lot of people are going to really be able to relate to this episode and get a lot out of it. I know plenty of my clients have struggled with headaches and migraines. I know a lot of women who struggle with some vertigo symptoms, men and women, but primarily who I talk to is more so on the women's side. So I think they'll get a lot out of this. So I'd love if you would just even start off by addressing, what are some common causes of both headaches and migraines and also vertigo?
So, before I started deep diving into what can cause it, let's just talk about more of the anatomy aspect of like how things function and work in the body. So, your nerve system is actually already controlled by your brain, your spinal cord. So, essentially, your brain sits in your skull, your spinal cord runs through your bones called your vertebral body. So, the holes are nerves and muscles that go to everything. So, basically, it goes to your tissues, your organs, essentially everything. So, what can happen over time? Bones can become misaligned. And so when two or more bones are misaligned in your spine, it's called a vertebral subluxation, or I call it for short subluxation misalignment. So essentially, brain will send signals to the rest of the body, and it can't communicate if your subluxation misaligned.
Okay,
So
so
go ahead.
misalignment.
Yes. So main thing what I do when it comes to headaches and vertigo, when someone comes to my office, I automatically go to their neck. Okay. So when your subluxation is aligned to your neck, it's actually called your cervicals, can put pressure on the nerves. So the nerves that live in the upper portion of your neck actually are the nerves that go up to your head from migraines and headaches. So when someone comes in for that, when I take their x-rays, I'm like, okay, specifically looking at that for them, that can have that feeling of dizziness or vertigo too. So also another common cause can be muscle tension. So think about it. Mostly everybody's working computers, right? So poor posture, which a lot of us have, right? I'm working on it myself. Stress, especially stress usually is housed in your neck and your shoulders. And also prolonged screen time, right? On our phones, on our computers, that can contribute to that too. Also, there's a joint called your TMJ joint, or it's called temporomandibular joint dysfunction. So that's basically the joint that runs right along your jaw, and that can cause pain or discomfort that radiates into your head. That can lead potentially headaches, right? And last thing is your inner ear. So a
Mm.
lot of times those crystals in your inner ear can get locked, and they can cause vertigo too as well.
Okay, so inner ear, TMJ, muscle tension, stress, misalignment
You got it. You
being
got
big ones. Okay. Yeah, I'm like, I feel like that's all encompassing. I'm like, yeah, check, check, check. I feel like probably
it.
been a lot of people check off a lot of those boxes. So
Exactly, exactly. And there's not one person comes in, I have none of those. I'm like,
yeah.
you probably have at least one of those going on.
Yeah, yeah. And it just like makes sense when you actually think of those root cause, of like, okay, why am I having headaches? Like all of those things make sense as causes for it. And do you see that for both? Is that apply to both like headaches and migraines and also vertigo too?
Yeah, a majority of the time I see that, and specifically more than likely, it's usually from cervicals that I see the vertigo, because vertigo has a lot of things to deal with your inner ear and the nerves that go right to your ears. And I'll kind of get a little bit more information about that in just a little bit with vertigo, but just to touch on it a little bit.
Okay, cool. Well, if you could share with us just about how I know you talked on like how spinal alignment affects headaches and migraines. That's one cause. But any specific like chiropractic techniques or adjustments that are effective in treating headaches and migraines?
So of course, adjusting your neck, you kind of touched on already. That's my go-tos when someone comes in and says, I have vertigo, I have headaches, migraines. Another one we use in our office is a specific instrument. And it's kind of like my go-to as well. So in our office, you've been in our office before too, we use what's called the Pedibond system. So this instrument is part of the Pedibond system. So basically what it does, it focuses on right underneath your scoliosis and right in between your first bone called your atlas. So it really focuses on that space between those two. And when I find when someone comes in with migraines or headaches and we take the x-rays, typically that space between your occiput of your skull and your C1 vertebrae is narrowed. So
Mhm.
I use the instrument to actually help open up that space to allow your nerves to go right to your head to help with the headaches and migraines.
Gosh, I feel like just like even thinking about that right now is making me like feel like more stress free. I'm like
Yeah,
just thinking
it's
about that
really
space. I'm
amazing.
like,
Especially like with vertigo, it's another go-to with vertigo is specifically doing it's called like the occipital lift with it, but it's called the negative Z. That's the instrument what it's called. And I think it should be called like the positive Z because it does so much great work for you guys with it. And it also helps with fogginess and clarity too as well. So someone comes in like, oh, I just can't focus and stuff. I'm like, all right, we're using the negative Z today.
that's literally like just even like thinking about it. I'm like, so actually getting the physical adjustment, but I'm like, oh my gosh, I can feel like just like the weight lifted or like the mental clarity. I'm like, it's like I can feel it.
Yeah, I love it. I love
Do you
it.
notice with people, because I really am like knock on wood and blessed to have not like I really don't get headaches, migraines. I have not experienced vertigo, but I like plenty of my friends do, clients have. Do you notice when people are coming in for adjustments? Do sometimes, I'm sure it depends on the person, but like, do you often see like immediate relief, or is it like, okay, they might, get some relief eventually, but like not to expect, like, or do you see a lot of people like having that immediate, like, oh my gosh, headache relief?
So it depends on the person, to be completely honest for you. Some of my
Yeah.
patients, it's automatic relief. Sometimes it takes a little bit. And sometimes as I'm adjusting them to finish up their adjustment, it slowly goes down. I had a lady who started with me years ago, and she's a lawyer, and she came in, she had chronic migraines. So I told her, I was like, look, I'm gonna do everything in my power to help you. Let's just see how it goes. And she had her first adjustment, I'll never forget it. She looked at me because she had a migraine at that time. She's like, oh my gosh, it's gone. What happened? What'd you do? And so typically adjustments, when you first get adjusted, it only typically holds your body holds the adjustment for about 2 or 3 days. So I did a little bit work with her. She had like twice a week for maybe like 2 or 3 weeks, to see how she was doing. And eventually it led to maybe once a month now. And every time I ask her, because she's one of my original patients, she says, I haven't had a migraine. I haven't had a migraine. She maybe gets a migraine maybe once a year, if that. It's just so amazing. And she's a lawyer. So she has a lot of stress impacted on her. So it truly changed her life on it.
Oh my gosh, that's amazing. That's so awesome. I have like one friend who just gets chronic like migraines all the time, and I'm like, she goes for some occasional chiropractic adjustments, but not anything very consistent. I think it's more when it's acute pain
Right.
for something else. So I'm like, oh man, this I know that immediate relief has got to be life changing if you're someone who really struggles with migraines because they
And
can be
what's
so
scary,
debilitating.
yeah, what's scary too is finding that children are getting migraines and headaches now. And believe me, when I was a kid, I didn't know what a migraine headache was. But I'm seeing more and more, especially since COVID was around, more children coming with more anxieties and headaches and migraines and stuff. So I always ask them, as soon as they come in, they know I'm going to ask them, how's your water intake?
Yeah.
And it either goes one way or another. One way it goes is, oh, I'm doing great with my water. I'm bringing my water bill around. And the other time is like, I really need to work on that.
Yeah. It's like one or the other.
Oh, yeah,
Well,
always one or the other.
which I was going to ask you about is like even other lifestyle changes or factors or habits that can complement chiropractic care and adjustments that could help with headache relief too. Water being one of them.
Oh, absolutely. Water. So regular exercise, which is perfect for what you do, right? Regular
Yeah.
exercise not only improves circulation, reduces muscle tension, and releases endorphins, which is great. So if you're
Yes.
feeling like you shouldn't work out, please work out.
Yeah.
But engaging in like cardiovascular tips such as walking, swimming, probably not when you have vertigo, not a good idea to do swimming, cycling, just getting out there, getting out in the outdoors, strength training, as you know, too, as well, helping build those muscles and bones around that spine can help. Also, incorporating core strength and flexibility is huge too as well. And everyone needs to work on core, including myself.
So good. Do you recommend, because obviously for vertigo, you're like, okay, you're just like spinning. So swimming's probably not the best thing for that. But what about even for headaches and migraines? Would you recommend like activity for someone who's having or is that more preventatively for headaches and migraines versus like if you're having a headache or migraine?
That's actually a good question. To me, I've had one migraine in my life, and that was not fun. I was actually at work, and I just felt it starting. So if I put myself in that person's shoes, if
Yeah.
I had a headache migraine, I'm probably not going to want to do anything.
Yeah.
At that point in time, I would probably have my chiropractor on speed dial, which is either Dr. or Dr. Joe, and be like, "Hey, I'm having a headache migraine." And sometimes I do that during the shift. I'm like, "Hey, do you mind adjusting me in between patients?" Like, "Yeah, what's going on?" I'm like, "I got a headache." Okay.
So
So I'd rather
good.
address the root cause of it than kind of doing other things. Now, it just depends on the person. Like some patients, they get really bad migraines and they can't drive. So I'm not going to tell you to get your butt in the car to come see me if you can't drive, obviously. That's not,
Yeah.
I don't want you to get in a car accident.
Yeah.
So it really depends on the person.
So good. Because like I've actually had, I think that's to your point, like migraines and vertigo would be kind of like next level. Like it's for someone who can't hardly open their eyes because their migraine is so bad. Probably can't come see your chiropractor in that moment or like go for a walk. But I've had like whether I'm experiencing PMS symptoms or having a headache, if I go and work out, I'm probably also hydrating more if I'm being more active. So that's probably helping too. But like the combination of like the blood flow and the activity and the hydration, like I can alleviate a headache or even
Mhm.
PMS symptoms from doing those things. And
Oh,
like
absolutely.
they're not what
Absolutely.
you feel like doing in the moment, but I'm like,
Right.
huh,
I mean, my poor sister, I remember when she was in high school, she used to get really bad migraines. And I would go in her room, her lights would be off, she wouldn't be able to go to school and stuff. And other times, like headaches and migraines, I'm like, okay, migraines are really bad. But headaches, you can at least probably function and be able to do some exercises. Also, speaking of exercise, like stress management, that's a huge thing too with headaches, which we don't have stress at all in this world. So just honestly taking it when you have a headache, just take some deep breaths in and out. I mean, it could just get some blood flow, oxygen, get that blood flowing. Meditation, do a little yoga, tai chi, take some relaxing rest, or just engaging in some hobby. If it's going outside nature, just getting your eyes away from the screen of the computer. I mean, it's crazy. Connecting with loved ones too, like, hey, I miss you. That can be a good one too.
so good. I'm like talk on it with the stress relief factor. I was just having this conversation with someone the other day who, she's working on some body recomposition goals and she's like I like am struggling with the body recomposition of losing fat and putting on the muscle mass that I want. And she's like, I do know stress is a factor. She's like, and then lists all these things. And I was like, you could be doing everything right with your nutrition and your training, but if your recovery and sleep and stress are not where they need to be, then you're going to have a really hard time seeing that progress. I think it's one thing we all like, I don't know, stress is just one of those things we overlook. And I'm like, it's a big deal. And and if you address it, it can fix a lot of problems too.
Absolutely, absolutely. So when I have a patient that comes in, I can kind of tell when they're stressed out. They're kind of quiet and they're like
Mhm.
really focusing. But then, more importantly, when they lay face down, I look at their leg length, and you want your leg length to be within a quarter inch and balanced. And sometimes they're like at least an inch off. And then I'm like, what's going on? And then I start working on their spine, and all of a sudden it gets their low back super tight. And then I'm going to the neck and the shoulders, and I'm like, this is not you. What is going on? They're like, oh yeah, by the way, I got this going on. I'm like, okay, let's get you adjusted. Let's get your body functioning at its optimal level. Let's get some of that stress taken off of you. Let's just take a break for just a second. It's crazy what your
Yes.
body can tell you.
Well, okay, I was going to ask with the leg misalignment or like the leg length being longer, does that like go back up to the stress in the shoulders, or like where does that come from someone being stressed?
Yeah, so leg length is huge. So leg length it really coincides with subluxation misalignment. So think about it. If you're stressed out, your muscles are going to get so tense, right?
Mhm.
So if you're subluxated, it's going to draw those muscles up, which are going to get shorter, which means that leg length is actually going to get shorter. So there's a difference. Does that make
So
sense?
so
So it's
interesting.
kind of like
Yeah.
a cheat sheet for me when I'm looking at your spine. Because when you are a little bit off or like an inch off, I'm like, okay, something's definitely going on. There's a subluxation here. Let's try to address it.
So good. So good. I know I've come in there a time or two and I have like that low back tension. My legs are a little bit off leg length wise. And then the neck tension, man. Neck and traps. I'm like, oh gosh.
I had
Um,
felt your neck. We had to work on that.
yeah. Could probably use it again here. But no,
Highly
this,
recommend it.
yeah, I'm gonna get back in there. Well, do you have anything else before we kind of move over to vertigo a little bit? Anything else for you want to add for headaches and migraines?
So everyone always asks me to, what kind of foods can I eat to help with this?
Hmm.
Or what can I eliminate from my diet to help with migraines and headaches? So number one thing that I find with migraines, especially their triggers, is cheese can cause migraines, potentially, right? And then of course, red wine. Red wine's another
Mm.
one. I know. I know.
No charcuteries, no charcuteries in
I know. Why did
it.
you take all like the bad stuff, right? So of course, what can help is also eating like great foods, such as not processed foods. You want to be more lean protein, fruits and vegetables. Another thing you can add is more magnesium to your diet. So more
Mm.
magnesium rich foods, such as almonds, spinach, and avocados. Those are really good to help with your diet and incorporate that. Another thing is limiting screen time. So not being on your phone right before you go to bed, using blue light glasses when you're at your computer for long periods of time. There's also an app, or it's actually a system, I guess. It's called Flux. I don't know if you've ever heard of it before,
Mm-mm.
but it's Flux. And you can actually download it to your computer. Now, I downloaded this on my computer a long time ago. It was free back then. I don't know if it costs anything now. But basically, what it does is set the dimmer switch on the amount of blue light going to your eyes throughout the day. And so depending on what time of day is the amount they have like a degree of red light that kind of like sends through your system, which is really nice. So if I'm working super late on my computer, it'll be more of this like red tint. And it's funny when my husband looks over, he's like, "What are you looking? Why is it so red?" And I said, "Well, it's taking that blue light out so I can go to sleep better."
Yeah.
They also have an app for your phone too for it as well. And then of course sleep. Sleep's really, like we already talked about that a little bit, but sleep's huge. So typically we're supposed to get what, 6 to 8 hours of sleep, right?
At
In
least
a
six.
night.
I always say like minimum seven, like get you seven or more.
I know. So
Uh,
I found that if with my bedtime is 10 o'clock Monday through Friday, right? I don't have to set an alarm anymore because I'm on that rigorous schedule of like 10 o'clock at night, that my body will automatically wake myself up between 6:30 and 7, which is pretty cool.
yeah.
Now, since I have to take care of my patients, and sometimes they be off at 7 o'clock in the morning, I do have to set an alarm. But also, when my daughter, she's 2 years old now, I can't believe it. When she started around 2 months, her circadian rhythm started. So I started putting her on a sleep schedule. And if you know me or my family, exactly 7 o'clock every night, Mackenzie is getting a bath. She's brushing her teeth. We're brushing her hair, and we have story time. And then she runs across the house and grabs her favorite stuffed animal, and then we lay her down to go to sleep. And she sleeps throughout the night. So,
Uh,
but we do that rigorously every single night, and she sleeps like a champ too. So, sleep's huge.
so good. So good. And it's like, and you're really training your body to that's why you're able to wake up at the same time every morning. Like it's our bodies love routine and become
Absolutely.
creatures of habit. So it's like you're literally have trained your body to just be able to do that. And it's like it craves that too. I think really thrives on that routine,
Oh, absolutely. Absolutely.
having that. And I do know I have not heard of that app. What is it called? Is it
Flux,
Flux?
Flux. Someone told
FLU.
me there was an app, but I know you can go to like Flux, like Google it, and you can at least download it for a computer.
Nice. I have the new like on one of the new iPhone update settings, you can set it to do that on your phone. So I do have that. It'll get like more orange, red tinted at night, but I don't have it for my computer. I'm also trying to be better about wrapping up work at night, not so late. So I'm like, it's more incentive for me to not work on my computer at night. Awesome. Well, let's jump into some vertigo conversation too. Like, are there any other potential underlying causes of vertigo that we haven't addressed as far as like, I know we addressed kind of some that are probably crossover from headaches and migraines, but any potential underlying causes of vertigo that chiropractic care can address, or just touching on causes in general?
Well, I mean, of course, I'm going to talk about your neck, right? Because of the
Yeah.
nerves that go up your head and your ears and everything else too. So obviously, looking at the upper cervicals, that's going to really help. But what's also important is that with your ears has a system called your vestibular system, which helps control balance. So if your subluxation in the upper portion of your neck can cause pressure on those nerves that communicate with the inner ear. So that can potentially cause vertigo too. So as chiropractors, what we do is locate and correct the vertebral subluxations and gently put everything back in proper alignment so you can have that restoration of proper communication between the brain and the inner ear. That's why.
Awesome. Okay. So it's restoring the alignment between brain and inner ear,
Mhm.
going through the neck and head.
Yes,
Okay.
that's what I find.
Awesome. Awesome. And even that, another question there too, like, do you find, and again, depending on the patient, but that some people like literally could come in having vertigo symptoms, like, and have those like almost with the right adjustments, almost immediately alleviated?
Sometimes it does, sometimes it takes a little bit, and sometimes it does. It depends. So it could be coming right, like I said, right from the neck. Also, like I said, coming from the inner ear. But I find also that some people have BPPV, so benign proximal positional vertigo, which basically is when the crystals in your inner ear get dislodged or they're get locked in place, and then that can cause your body to go into that dizziness spell that you can't walk straight, you feel like you're on a cruise. And so what I do in our office, I do what's called an Apley's maneuver. So basically I put your head in specific directions that can help those crystals get come obviously dislodged, right?
Mhm.
And so that helps a lot of folks, but I do that after I adjust you, of course, and that helps a lot too. Sometimes it's immediate, sometimes it takes a little bit, sometimes it takes more than once for it to happen. Um,
Awesome.
some things I do see.
Awesome. And then are there exercises or stretches that patients can do at home to also support chiropractic treatment for vertigo?
Well, I do a combination of headaches and migraines with the vertical stretches and like some strengths that I find that are helpful. But of course, what's going to be even more helpful is when you come in, I do a full exam with you, and then I do some more tests to see what specific exercises you can do. So the exercise I'm going to recommend is more of like a general for you guys to help in the long run. And of course, one of the favorite strengthening exercise I like to do is for to help with your posture too. So to answer your question, it really depends on the person. But what I can do is kind of walk you through some exercises that I love too. So the first one is like a cervical spine stretch. So basically what you're going to be doing is you're going to sit properly in your chair, right? Feet are flat on the floor, back straight. You're looking great. Chest is, nice and straight. So what you're going to do is you're just going to bring your ear to your shoulder. There you go,
Mm.
like a clock.
My
And you
neck
just
already
hold
popped.
it there.
My neck already popped doing it.
Someone sounds like they need to come in.
Yeah.
Uh, and then you're holding there like 15, 20 seconds. And then you're going to go to your other side and just hold it there. It's a nice stretch. So you feel a nice stretch in your neck into the shoulders. Because we don't do this position a lot, right? Unless we're thinking really hard. And
Yeah.
then you're going to come back to center. And then you're going to bring your chin to your chest. And yes, your chin is actually supposed to touch your chest.
Mm.
And then
Feels
you're
good.
going to hold that for like I said, 10, 15 seconds. And then you're going to look straight up. And you're going to hold it there for 10, 15 seconds. All right. So, and you come
Mhm.
back to center. So it's one of the great stretches I like to do just to kind of like, okay, shake things out when you're just sitting on your computer for so long. Another one's called levator scapulae stretch. Okay. So
Okay.
for this one, you're going to take your arm and go across the other side of your head like this. And then what you're going to do is you're actually going to turn your head just a little bit, and then you're going to look down. You're going to feel that nice stretch like you're looking at your underarm.
Mm.
Hold it there for 20, 30 seconds. So now you're really starting to feel that stretch into your neck and shoulders,
That feels great.
doesn't
Yeah. Anyone not watching on YouTube, you can go to YouTube to watch, or you can
it?
listen to the
All right, so
cues
you're
and
gonna
try
come
this
back
on
up.
your own.
And then you're Your other hand, reach to the other side of your head and turn your head like 45-degree angle. Then you're gonna look down like you're looking at your underarm. You're gonna hold it there.
That's so good. So, so good.
All right, that's another good one. The last one I call it's called chin tucks. It's one of my favorite ones. So basically, you're gonna put your finger on your chin, and then what you're gonna do is you're gonna bring your head back, like you're retracting, and then you're gonna come forward and just touch your finger. So your finger stays in place the entire time.
Ah, okay,
You're bringing
okay.
your head back, and then you're gonna come forward. So basically, you're doing a chicken.
The chicken. You know what's funny is doing this gives me a nice, beautiful double chin. And is making me laugh because I just saw a reel of a girl talking about her kill switch. Have you heard of that?
No.
She was like, my mom and dad gave me the kind of pretty where I have a kill switch. And she's like, and so basically she just tucks her chin and gives herself a double chin. She's like, just in case of emergency, if I ever need someone to not come after me, I just use my kill switch. And she gives herself a double chin. So I'm like, that's our kill switch move.
It's funny when I actually introduce this to kiddos too, because like they're looking down at towels and stuff too. So I literally ask them like, "Are you doing the chicken at home?" And they're over there doing this in the
Uh, uh,
office.
uh. So good. So, so good. Thank you for those and for sharing those exercises. Anything else that you'd like to add? This has been great and pretty all encompassing. Anything else you would add for vertigo and or headaches and migraines?
I think that's pretty much it. But yeah, of
Awesome.
course, getting adjusted, I'm always going to recommend.
Yes. So good. So, so good. Well, Dr. Callie, thank you so much for your time. Go check out her last episode that we did together, episode 62. And then also, I'll drop your information in the show notes again, but just so everyone listening can hear as well, what is the best way to reach you guys? What's the best way to find you?
So you can call our office at 804-359-6999, or you can visit our website at www.chawc.com, which stands for Chiropractic Health and Wellness Center.
Chiropractic Health and Wellness Center. I love it. I love you guys. Thank you so much for your time today. I really appreciate it.
You're welcome. I'm glad you invited me back. It was fun.